huge impact for our families, communities, and for the country. I'll start by reminding all Canadians to continue to follow public health experts regarding the practicing of physical distancing, hand washing, and wearing a mask to protect yourself and to help protect others as well. J'aimerais rappeler aux Canadiens de continuer de suivre les recommandations de nos experts de la santé publique, c'est-à-dire la distanciation sociale, le lavage des mains et le port du masque. Je tiens également à vous rappeler que l'application Alerte COVID est un outil important qui nous permet de garder en sécurité l'un l'autre. L'application est déjà disponible à Terre-Neuve et Labrador, au Nouveau-Brunswick, en Ontario et en Saskatchewan. Notre gouvernement collabore activement avec les autres provinces et territoires et l'application sera active très prochainement dans d'autres régions du Canada aussi. Je vous encourage tous à la télécharger dès aujourd'hui. As a reminder, the COVID Alert app is an important tool to keeping each other safe. It's already available and active in Newfoundland and Labrador, in New Brunswick, Ontario, and Saskatchewan. Our government is actively working with other provinces and territories, and it will be rolled out to more Canadians very shortly. And I encourage everyone to download it today. No matter the situation ahead of us, we will continue to adapt our approach to this ever-changing pandemic environment, working with provincial, territorial, municipal, and community partners, Indigenous partners all across the country. Once again, thank you for being here today. Une fois encore, merci de votre présence aujourd'hui. Je vais maintenant demander à notre collègue, la ministre Anand, de faire une annonce et ensuite la ministre Haidoo et nos médecins vont ensuite prendre la parole. So, Anita, over to you.
Merci, Dominique, et bon après-midi, tout le monde. As we continue to see the rise in reported infections, we know that now, more than ever, each and every one of us must redouble our efforts to help curtail the spread of COVID-19. Notre gouvernement continue de mettre l'accent sur la protection de la santé, de la sécurité de toute la population canadienne. De plus, mon ministère, Services publics et approvisionnement, demeure déterminé à assurer
remains focused on helping Canada be ready when it comes to having enough personal protective equipment or PPE and other medical supplies for any potential scenario.
Cela comprend l'achat d'EPI,
That includes procuring essential personal protective equipment, treatments, and tests to protect Canadians.
With renewed efforts to keep community transmission at a minimum, testing and tracing are more important than ever. Today, I am announcing that the Government of Canada has signed a new agreement with Abbott Rapid Diagnostics for up to 7.9 million rapid point-of-care tests for COVID-19. This is a nasal swab-based point-of-care test with results in approximately 15 minutes. As with many of our agreements for equipment, tests, and vaccines, we have pursued an advanced purchase agreement to secure Canada's access to these tests, conditional on Health Canada regulatory approval. This has been our proactive approach, and we will continue to employ it in these types of procurements. Required assessments and validations are taking place expeditiously, and at the same time, we are continuing to pursue other rapid test agreements as well. These rapid tests will aid in meeting the urgent demand from provinces and territories to test Canadians and reduce wait times for results, which is key to reducing the spread of the virus. In addition to testing, I will also provide an update on other measures employed to prepare for future phases of this pandemic. Through our procurements, we now have more than $2 billion items of PPE for Canadians. We will continue to receive steady, ongoing deliveries of all types of PPE in the coming months. With this increase in numbers of PPE deliveries, including 40% of the total dollar value of contracts now going to domestic companies, our existing warehouses are stretched to capacity. This is a sign of proactive PPE procurements. Mais aussi, c'est pourquoi je suis ravie d'annoncer qu'au nom de l'Agence de la santé publique du Canada, Service public et l'approvisionnement a attribué un nouveau contrat à Metro Logistics de Montréal afin d'aider à l'entreposage et la distribution de PPE aux provinces et territoires. Alors que la livraison de commandes se poursuit, cette capacité accrue de l'Agence de la santé publique est entreposée et à distribuer le PPE est primordial. In addition to PPE, logistics will be just as important when it comes to distributing vaccines. With bilateral agreements now in place that provide Canada with access to 6 different vaccine candidates and up to 282 million doses of vaccines, we will be ready to deliver vaccines to provinces and territories as soon as one or more vaccines are approved for safety and efficacy. It is important to note that Canada has already in place a robust system for vaccine distribution to ensure access to vaccines based on seasonal flu and other routine immunization programs. However, depending on which COVID-19 vaccines are ultimately approved, warehousing and delivery will come with unique specifications and will require a wholly unique logistics solution. In addition to the detailed planning underway inside government, we are also seeking information from industry directly to support the transport, storage, and distribution of potential COVID-19 vaccines. Last week, the Government of Canada issued a broad letter of interest to industry, inviting input on industry's logistic capabilities and expertise. We know that planning for a national mass distribution of new vaccines will be complex, and we will leverage all the resources at our disposal to achieve this. In short, when a vaccine is ready, Canada will be ready also. Our approach has been and continues to be proactive and aggressive. In closing, let me offer some assurance to Canadians. As the Prime Minister has said, we have your back. We are in this together, and we will get through this together. And I personally will not rest until these procurements for Canadians are in place for Canadians here and now. Throughout protective equipment, through treatments, through an eventual vaccine, and through the collective efforts of each and every citizen, we will beat this virus together. Merci beaucoup, Megwetch. Thank you so much.
Merci beaucoup, Anita.
you
Alors,
very much,
maintenant, la ministre de la Santé va dire quelques
The
mots et
Health Minister
ensuite
will say
le
a few
Dr.
words,
Tam
and
et
then
le
Dr.
Dr. New.
Tam and Dr. New.
Merci Dominique. Bon
Thank you,
après-midi.
Dominic.
Les nouvelles
Good
annoncées
afternoon.
par Québec hier
The
sont
news
difficiles.
announced by
Je veux
Quebec
commencer
yesterday
en
was
parlant de
hard to hear.
ressources
Let's
qui
start
sont
by talking about
disponibles au
resources that are
Canada.ca.
available at Canada.ca.
N'hésitez pas à faire
Please
comme
don't
plus
hesitate
de 400
do
000 personnes qui
like more
sont
than
allées sur
400,000
notre
people
site
who
pour
have
prendre soin
gone to our
de
site
leur santé
to take
mentale
care
et
of their
parler
mental health
avec une
and speak
professionnelle.
to a healthcare professional.
This spring, we allocated $4.28 billion to the provinces and territories to increase testing and contact tracing. For an overview on how provinces are meeting their goals, you can follow their progress on canada.ca/coronavirus. We also know that new tools are needed to fight COVID-19, and we're working around the clock on the approval and procurement, as Minister Anand talked about, of new testing technologies so Canadians have access to better and faster testing no matter where they live. We've approved 36 tests to date, including 2 that are point of care that can help with rapid testing in specific populations like rural and remote communities. To date, we have not received any home test kits for review, but we're actively engaging with companies that produce these types of tests to encourage them to apply here in Canada. And when they apply, we will be ready. We have doubled our people, and we've sped up our processes to review tests and grant decisions quickly within 40 days of an application. The world is seized with COVID-19, and researchers and scientists are working day and night to work on new tools that will better track and treat this illness. As we learn to live with COVID-19, testing will continue to be a key part of our public health approach, and will continue to be there for provinces and territories and regions that are struggling with outbreaks of COVID-19, including mobilizing federal testing surge capacity to help them with those needs. But we can't underestimate the power of our own behavior. The most effective public health measures continue to be washing our hands, physical distancing, wearing a mask, and socializing less. I also implore people who are not feeling well to stay at home when they're sick and to reach out to local public health for advice. And please download the COVID Alert app and join the 3 million Canadians that have done so to date. COVID-19 is taking a toll on all of us. It is hard to stay apart, especially when others are reaching out. But it is an act of love. We can protect each other, we can flatten the curve again, and we can save lives. Merci.
Merci beaucoup, Patty. Dr. Tam?
Thank you very much,
Good
Patty. Dr.
afternoon
Tam.
and bonjour à toutes et à tous.
Good day, everyone.
There have been 155,301 cases of COVID-19 in Canada, including 9,278 deaths. Labs across Canada tested an average of over 71,000 people daily over the past week, with a 1.7% testing positive. Yesterday, a total of 2,176 cases were reported nationally. 437 of these were backlogged cases from the weekend, and 1,739 were newly identified yesterday. This means daily case counts has now reached the peak of daily cases seen in April, and the average daily case count has increased to 1,412 cases being reported during the most recent 7 days. The fact that cases are now at the same level as during the initial peak is worrisome. But at the same time, there are clear differences in the epidemiology, with younger age groups predominating among cases, and we are testing and detecting more. Things have escalated quickly, and they can escalate further unless we all work together to slow the spread of the virus. There is no doubt that testing, tracing, and isolating in order to interrupt transmission of the virus and prevent further infections is a cornerstone of our pandemic response. Public health authorities are working hard to find a range of testing solutions to improve access and speed up the turnaround time for results. In Ontario, for example, as in Alberta, tests can now be performed in pharmacies. British Columbia has introduced a spit and swish testing method, which will be used as an alternative to the nasal swab, especially for collecting samples from children. Health Canada is reviewing a range of simpler to use and faster tests. As the regulator, Health Canada is responsible for ensuring the safety, effectiveness, and quality of all tests, which is crucial for disease management. For example, an underperforming test could result in a high number of false negative results, where people think they aren't infected when they are, leading to unintentional exposures. This is why the review process is so important and why no corners can be cut. As the number of cases rise and the demand for testing increases, testing will be most important for those who have COVID-19 symptoms, have been exposed to a confirmed case, or are part of an outbreak investigation, or have been otherwise advised by local public health to get tested. As I have said before, getting tested for COVID-19 is an act of kindness that can protect you, your family, and your community. I also wanted to mention a new online tool called COVID Trends, released by the Public Health Agency of Canada. It provides you with the number of confirmed COVID-19 cases in your area within the last 14 days. This is another way to stay informed about COVID-19 activities in your community and help you make informed decisions to keep yourself and your family safer. And as always, I want to end by asking everyone to follow the public health practices we know to be effective, including physical distancing, frequent hand washing, and wearing a non-medical mask in closed spaces, crowded places, and close contact situations where distancing is difficult. Most importantly, stay home and self-isolate if you have symptoms, even mild ones. Thank you.
Dr. New?
OK. Merci. Bonjour à toutes et à tous.
Thank you.
Il y a eu 155 301 cas de
There have been
COVID-19 au Canada,
155,301
dont 9
cases of COVID-19 in
278
Canada,
décès.
including
Au cours de la dernière semaine,
9,278
les
deaths.
laboratoires de partout au pays
Labs
ont
across
analysé
Canada
les tests
tested
de
an average
dépistage
of over
de plus de 71 000 personnes en moyenne par jour, dont
over the past week,
1,7
with
ont obtenu un
1.7%
résultat positif.
testing
En
positive.
tout, 2176 cas ont
Yesterday,
été
a total
signalés
of
hier à l'échelle nationale.
2,176 cases
De ce
were reported
total,
nationally.
437 cas sont survenus
437
en
of
fin
these
de semaine
cases
et
were backlogged
1739 sont de
cases
nouveaux
from the
cas
weekend,
qui ont
and
été signalés hier.
1,739
Cela
were
signifie
newly
que le nombre de
identified
cas
yesterday.
signalés quotidiennement
This means
a
daily
maintenant
case count
atteint le
has
pic
now reached the
observé
peak of
en
daily
avril
cases
dernier
seen
et
in
que la
April,
moyenne est passée à
and the average daily
1412
case
cas
count
pour
has
les 7
increased to
derniers jours.
1,412
Le fait que
cases
les
being
cas
reported during the
sont
most
maintenus
recent
aussi
7
nombreux
days.
que lors du pic initial
The fact that
est
cases are now at
préoccupant.
the same level
En
as during
revanche,
the
les
initial
données
peak is
épidémiologiques
worrisome.
font
At the
ressortir
same
de
time,
nettes
there are clear
différences
differences
entre
in
les tranches d'âge, la
epidemiology,
majorité
with
des
younger
cas
age
survenant
groups
chez les jeunes,
predominating among
et nous
cases,
réalisons
and
plus de tests
we are
et
testing and
détectons plus de
detecting
cas.
more
La
cases.
situation s'est détériorée
Things have
rapidement
escalated
et elle
quickly,
peut encore
and they
s'aggraver
can
si
escalate
nous ne
further
travaillons pas
unless
tous
we all work
ensemble
together
pour
to
ralentir
slow
la
the spread
propagation du virus.
of this
Il ne
virus.
fait aucun doute que le dépistage, la recherche des
There is no
contacts
doubt
et
that
l'isolement
testing,
pour interrompre
tracing,
la
and
transmission du virus
isolating in order
et
to
prévenir
interrupt
les
transmission
nouveaux
of
cas
the virus and
constituent
prevent
des
further
éléments
infections
fondamentaux
is a
de notre
cornerstone
intervention
of our
contre la pandémie
COVID-19
de
pandemic
COVID-19.
response.
Les autorités de santé publique travaillent
Public
sans
health authorities
relâche
are working
pour trouver
hard to
différents
find a
moyens de
range of
dépistage
testing solutions
permettant d'améliorer
to
l'accès
improve
et de
access
raccourcir les délais
and speed up the
d'obtention des
turnaround
résultats.
time for
En
results.
Ontario, par exemple, comme en Alberta,
In
les
Ontario,
tests
for
peuvent
instance,
désormais
and
être
in Alberta,
effectués
tests
en
can now
pharmacie.
be performed in
La
pharmacies.
Colombie-Britannique a
British
lancé
Columbia
un
has
test salivaire
introduced
qui
a
servira de
spit and
solution
swish
de rechange
testing method,
à
which
l'écouvillonnage
will be used
nasal,
as an
surtout
alternative to the
pour les
nasal
prélèvements
swab, especially
d'échantillons chez
for
les enfants.
collecting samples from
Santé
children.
Canada examine divers tests
Health
plus
Canada
simples
is
à
reviewing a range
utiliser
of
et plus
simpler
rapides.
to use and
En
faster
tant
tests.
En tant qu'organisme de réglementation,
As the
le
regulator,
ministère est chargé de
Health
garantir
Canada is responsible
l'innocuité,
for
l'efficacité
ensuring
et la
the
qualité de
safety,
tous les tests,
effectiveness, and
ce qui
quality
est
of all
essentiel
tests,
pour lutter
which
contre
is
les
crucial
maladies.
for disease
À titre
management.
d'exemple, le manque
For
d'efficacité d'un test pourrait
an
conduire à un
underperforming
nombre
test could
élevé
result
des
in
résultats
a high number
négatifs,
of false
c'est-à-dire
negative
que les
test
personnes
results,
croient qu'elles ne
where
sont
people
pas
think they
infectées
are not
alors
infected
qu'elles
when
le
they
sont,
are,
et entraîner des expositions
leading to
involontaires.
unintentional
C'est
exposures.
pourquoi le processus d'examen est si
This is
important
why the review
et qu'il ne faut
process
pas
is so
sauter
important
d'étape.
and why no
Alors que le
corners
nombre de
can be
cas
cut.
à la demande de tests augmente,
As the number
le
of cases
dépistage
rise
sera
and the demand for
particulièrement
testing
important
increases,
pour les personnes qui
testing will be
présentent des
most
symptômes de
important for those who
COVID-19
have
qui ont
COVID-19
été
symptoms,
exposés à un cas
have been
confirmé,
exposed to a
qui sont
confirmed
visés
case,
par une enquête
or
sur une
are part
éclosion
of an
ou
outbreak
à qui l'autorité
investigation,
locale de santé
or
publique
have been
recommande le
otherwise
test.
advised by
Comme on l'a
local
déjà
public health to
mentionné,
get
se
tested.
faire tester pour
As
la
I have said
COVID-19
before,
est un
getting
acte de
tested for
bienveillance
COVID-19 is an
pouvant
act of
vous
kindness
protéger et
that can
protéger
protect
votre
you,
famille
your
et
family,
votre
and your
collectivité.
community.
On souhaite également vous informer que
We
l'Agence
also wanted
de
to
la santé
mention
publique du Canada a lancé un nouvel outil
a
en ligne
new online
appelé
tool
Tendance
called
COVID.
COVID
Il
Trends,
vous indique le nombre de
released
cas
by the Public
confirmés
Health
de
Agency of
COVID-19
Canada. It
recensés dans
provides you
votre
with the number
région
of
au cours
confirmed
des
COVID-19
14
cases
derniers
in your
jours.
area within the
Il
last
s'agit
14
d'une
days.
autre façon de vous
This is
tenir
another
au
way
courant de
to
la
stay
situation
informed about
dans votre
COVID-19
collectivité
activity in
pour
your
prendre
community
des décisions
and
éclairées
help you make
dans le
informed
but de mieux
decisions
vous protéger,
to
vous
keep
et
yourself
votre
and
famille.
your family
Pour
safer.
terminer, comme à
And as
l'habitude,
always,
on demande à chacun de
we want to
respecter
end by
les
asking
mesures de
everyone to
santé
follow the
publique
public health
qui ont fait leurs
practices
preuves.
we know to be
Maintenez une
effective,
distance physique,
including physical
lavez-vous souvent les
distancing,
mains et
frequent
porter
hand-washing,
un masque non médical
and
dans
wearing
les
a
espaces
non-medical
clos,
mask in
les lieux
closed
bondés
spaces,
et les
crowded
situations de
places,
contact
and
étroites
close
où la
contact
distanciation
situations
est
where
difficile.
distancing is
Le
difficult.
plus important,
More importantly,
restez à la
stay
maison
home
et
and
isolez-vous si vous avez des
isolate if
symptômes,
you have
même
symptoms,
faibles.
even mild
Merci.
ones. Thank you.
Alors, merci beaucoup, Dr.
Thank
New.
you very much,
Alors, on va
Dr. New.
procéder maintenant aux questions.
We'll now move to
Oui,
questions.
nous allons procéder à la période de questions. Nous allons
Question
commencer
period.
au
Let's
téléphone
start
avec
over the phone
3 questions,
with
avec
3
une question de
questions,
suivi
one
chacun.
follow-up
Merci.
each. Thank you.
Merci. Thank you. Please press star one if you have a question. Faites étoile 1 pour toute question. La première question est de Marie Vestel de
First
Le
question,
Devoir.
Marie
La parole est à
Vestel, Le
vous. Please
Devoir.
go ahead.
Oui, bonjour. Ma question est pour
Yes,
vous,
my
Monsieur
question
Leblanc.
is for
Je
you,
voulais revenir
Mr.
sur la hausse
Leblanc.
des cas au Québec dont
I'd like to
vous
get
avez
back to
fait
the
mention.
issue
Montréal
of
et la
the
ville de
rise in
Québec sont
cases
maintenant
in
considérées
Québec.
zones
Montreal
rouges.
and Quebec City are
Est-ce qu'il
considered
est
red
temps,
zones.
selon vous, de permettre aux policiers d'aller chez
Has
les
the
gens
time
pour faire
come
respecter
to
les mesures
allow police
sanitaires, les
officers to
consignes
go to
d'éviter les
people's homes to
rassemblements,
make
puisque
sure
c'est là,
people are avoiding
semble-t-il,
getting
qu'est le
together,
réel
because
problème
that
là, de
seems
la
to be
deuxième
the real
vague?
source of the problem for the second wave.
Alors, comme
Answer.
vous savez, le premier ministre
As you
Trudeau a
know, Prime
parlé
Minister
avec le premier ministre
Trudeau
Legault
spoke
hier
with
soir,
with Premier
simplement
Legault
pour
yesterday,
offrir une fois de nouveau
simply
la
again to
collaboration de
offer
notre
the
gouvernement.
federal
Nous
government's
partageons
cooperation.
l'inquiétude de tous les
We
Canadiens et des
share the
Québécois,
concerns of
évidemment,
all
avec ces
Canadians and
chiffres qu'on a vus
Quebecers
au
with
Québec.
these figures
Nous
that
allons
we've seen in
continuer de
Quebec.
travailler avec les
We will
autorités
continue to work
québécoises
with
de
Quebec
santé publique
authorities
et
in the
de
area of
sécurité
public
publique
health
pour
and
s'assurer
public
que toutes
safety
les
to
mesures
make sure
nécessaires pour
that all
protéger
necessary measures
les Canadiens sont en
to
place.
take into protect
C'est une discussion
Canadians
que
and
mon
Quebecers are in
collègue, le
place.
ministre
And
Blair,
this is a
peut
decision
avoir avec son
Minister
homologue
Blair
québécois,
this
mais
is
en
a
tout
discussion
moment, le
Minister Blair
gouvernement
can have with
fédéral
his
demeure
counterpart
prêt
in
à
Quebec.
appuyer les
But at all
autorités
times,
québécoises
Canadian
dans n'importe quelle
federal
mesure qui vont
government
augmenter la
sources are
protection et
always
diminuer évidemment le
prepared to
nombre de cas
support
inquiétants qu'on a vus au Québec.
provinces in order to reduce these frightening numbers.
So,
Croyez-vous qu'une décision, ça serait de permettre
Question.
aux policiers d'aller chez
Do
les
you
gens pour
think
s'assurer
one option
qu'on
would be
respecte les
to allow
consignes?
police
Et ma
officers to
sous-question,
go
vous
to
avez aussi
people's
mentionné
homes to
l'alerte
make sure people are
COVID,
compliant?
l'application
And
sur les
also, you
téléphones.
were
J'aimerais savoir où
referring
est-ce que
to
vous en
the
êtes dans les
COVID-19
discussions
app.
là-dessus avec
I'd like
le
to know where
Québec.
you're at
Est-ce que
with
Québec
that
pourrait
in your
finalement
discussions with Quebec.
changer d'idée et
Is it possible that
accepter
Quebec may choose to
de
change its
partager
mind
l'application
and
pour freiner la
share
deuxième vague?
this app
Alors,
in order
moi,
to
je répondrai en premier lieu et mon
slow
collègue,
this,
la ministre
spread?
Haidou, va ensuite ajouter
Answer.
quelque
I will
chose.
start by answering
Sur
this question, and
l'application,
Minister Haidou will
vous
have
avez
something to
raison, on
add. On
travaille
the app, you're right.
étroitement
We are working
avec
closely
tous les provinces et territoires
with all
afin de
provinces and
s'assurer
territories to
que
make sure
tous les Canadiens
that all
puissent
Canadians
avoir accès à l'application
have access to the app.
COVID Alert.
This
Alors,
COVID
nous
alert
espérons
app.
avoir des nouvelles
We
positives
hope we'll
dans
have
les prochains
positive
jours
news to share in
et
the coming days.
au pire dans les prochaines semaines.
And, worst case scenario, in the
Évidemment,
coming
la
weeks.
situation
Of
idéale,
course,
c'est
the
que
ideal
tous les Canadiens
solution would be for
aient
all
accès à cette
Canadians to have
application,
access to
y
this app,
compris au Québec.
including in
Mais
Quebec.
nous sommes confiants
And
qu'on
we
peut
are
travailler avec
confident
toutes les
that we can
juridictions
work
à
with
travers les
all
provinces et
jurisdictions
territoires
throughout the provinces and
afin de
territories
s'assurer
in
que ce
order
soit disponible et
to reach
accessible
that end.
à tout le monde.
So
Et
this
quant
is
à la
accessible to
question
everyone.
d'envoyer des policiers pour faire
As to the issue of
respecter
sending police officers to
les
people's
mesures
homes to make
de
sure people
santé
are
publique,
complying with public health
la
measures,
juridiction et l'autorité
the
est présentement dans la main des,
jurisdiction is within
des
the
autorités
hands
québécoises.
of Quebec
Et
authorities
comme
for
j'ai
these
dit,
things.
à
And
tout moment,
as
nous
we've
demeurons
said, at any
prêts
moment, we
pour
are prepared
appuyer
to
les autorités
support
de santé publique
public health
ou de
authorities
sécurité
or
publique
public
de
safety
la province du Québec
authorities
ou
in the
d'ailleurs
province
dans
of
d'autres
Quebec
régions du
or
Canada
any other region
afin de
of
s'assurer
Canada in order
que
to make sure
tout est disponible
that everything is
pour protéger les
available to
Canadiens.
protect
Mais pour le
Canadians.
moment, cette
At
autorité
this
existe
point, this authority does
dans les
exist
lois de la province du Québec,
in
mais nous allons continuer une
provincial
discussion
Quebec government
collaborative afin de
legislation,
voir
and
si on ne
we
peut pas
will
les
be
appuyer d'une
collaborating to make
façon
sure that we can see
accrue.
how
Peut-être, Patty,
perhaps
you
we
want to
can
add something?
support them further. Minister Haidou, anything to add?
Just to repeat the answer in English, as you know, the Prime Minister spoke with Premiers Ford and Premier Legault last evening. The conversation was simply to reiterate our shared concern about the increase in COVID cases in those two provinces, but right across the country as well. And the Prime Minister reiterated that the Government of Canada is available to support in any way that would be helpful the authorities in Quebec and in Ontario, but that is true, obviously, in every other province and territory across the country. The authority in terms of using public safety officials, peace officers, to respect public health guidelines and public health regulations is properly in the hands of provincial authorities. They have that authority now. But of course, if there was a way that the Government of Canada could be supportive and helpful or do something that would enable them to do this important work more effectively, we would be wide open to having that conversation with any province that asks for our help.
Nous allons passer à la prochaine question au téléphone. Modérateur.
Next question over the phone.
Merci. Thank you. The next question is from Ryan Tumilty from the National Post. Please go ahead. Your line is now open. Votre ligne est ouverte.
Yeah, hi there. I'm wondering, this Abbott test, as well as some of the more rapid antigen tests that are out there and that I know the Health Canada is considering approving, when Canada gets to the point of distributing them, are you looking at distributing them with some manner of warning about the situations, I guess, in which they are most accurate? I know especially some of the antigen tests are really only accurate with people who are very infectious or symptomatic. I wonder if there's any concerns about that.
So, Patty will start, and then maybe Anita or the doctors if they want to add something.
Well, thank you very much. And in fact, that's part of the regulatory process to make sure that all components of the test are there, including appropriate instructions for the use of tests and when it might be appropriate to do so and what circumstances. But I will turn to Dr. Tam and Dr. New to speak a little bit more about those specific questions on those specific tests.
Yeah, so every test is a bit different. So the instructions and the application of the test will come with the manufacturer and through Health Canada's approval. What I always say is that from the federal provincial laboratory perspective, we are getting together to update guidance as needed in terms of how you use those tests in the best, most useful way as well. For example, obviously, a test that may have a slightly lower sensitivity may have to be used in a different way than one that has more sensitivity and specificity, i.e. the kind of test you want to use when you absolutely have to diagnose someone in terms of whether they are case or not, whereas something with a slightly lower sensitivity may be used more for, say, screening purposes. So those will be discussed also at the Special Advisory Committee and our Canadian Public Health Laboratory Network.
And if I could just add something as well, Dominic.
Go ahead.
The tests that we're procuring from Abbott are point-of-care rapid tests. They're not antigen tests. The antigen tests are being procured in other jurisdictions, but this particular contract relates to point-of-care rapid tests. It is a swab-based test, and I just wanted to put that clarification out there for you, Ryan. Thank you.
Bonjour, les ministres doivent partir dans 2 minutes, donc nous allons prendre une question dans la salle et par la suite, les docteurs vont rester pour répondre aux autres questions.
Sorry, just one second. So my first question is for Dr. Tam. So the latest Public Health Agency of Canada weekly epidemiology report says the majority of cases, 58%, were exposed to an unknown source of COVID-19. Why can't we get more detailed information on where cases are coming from? We're telling Canadians to limit their activity, but why aren't you releasing detailed information on transmission rates in gyms versus bars versus backyard gatherings as examples so we can better learn about the risky behavior and where this is spreading?
Well, the indicator that you had mentioned is actually a very important one because, as you know, we get our reporting from the province and territories, and we keep track of that number because if you can't link your cases, that is telling us that perhaps there's more community transmission and hidden chains of transmission. You don't want that. You want the cases to be linked back to known sources of exposure, whether it's a case or whether it's an outbreak. So that is done at the local level. But we do monitor that parameter quite carefully and have discussions with chief medical officers if we see that proportion is larger than one would want to see. And that could be due to a whole variety of reasons, some of which is to do with the ability to turn the tests around fast enough in order to do contact tracing, etc. So, but what the number you mentioned is actually an important one.
Patty, did you want to add something?
Well, yes, I'll just add that that is part of the $4.3 billion transfer to provinces and territories, was to accelerate their abilities to do the contact tracing, but even, I would say equally importantly, ensure that their data systems are up to date. If you recall at the very beginning of COVID-19, we got data very little data, and also with a large lag. Now the provinces and territories are doing better, but in some provinces and territories, you're right, there are 50% or more unlinked cases, which is an indicator that we watch very closely, because it also implies that there is a higher degree of further spread when you can't pinpoint where people are coming into contact with COVID-19. And finally, I'll just say at the federal level, we have in the range of 1,500 additional contact tracers on loan to the government of Ontario right now through our Federal Reserve capacity. And this is something that is available to all provinces and territories, the ability to rapidly support provinces and territories with additional resources to get that number down.
It's Dr. New. Maybe I'll just add the real life sort of situation we're dealing with on the ground. I think it would be important for Canadians to understand that when we were, quote, in lockdown, or what happened in the spring with cases, people, when you were doing the contact tracing, were able to identify, oh, I've been in contact with 5 or 6 people in the past, 2 weeks. Now what's happening when cases are being detected, the number of contacts has jumped to like 20, 30 plus. So that already is, I think, an important sign that things are not the same as they were before. And that's also why it's becoming more challenging and difficult on the ground, even if we have the resources to go and find, a larger number of contacts for every case that's been confirmed.
The ministers will now leave to go vote and fulfill their parliamentary duties. So we thank them, but the doctors are staying on for more questions.
So I guess this is for Dr. Tam. So how do these 7.9 million rapid tests fit into your overall testing strategy? Who will be prioritized to get them first, in which provinces, and how quickly will they be rolled out?
I think it all depends on what we're getting and the characteristics of the test. But some of the key attributes of a point-of-care test is to be able to be deployed to more remote areas, to areas where you can't sort of send your samples without a really long turnaround time and you have to fly your samples, for example. So I think the key priority is high risk and remote settings. There may also be more high-risk exposure settings where it is really important to get that more rapid turnaround. So I think those will be some of the approaches. But again, this will be discussed with the provinces and territories and look at how they can best be distributed as well.
Thank you. Rachel Haynes here from CTV National News. My question is for Dr. Tam. On March 23rd, when you were speaking to us in West Block, there were over 1,400 cases cumulatively in Canada of COVID-19. Today now, or at least yesterday, we saw reported over 2,000 cases of COVID-19. On March 23rd, you said that people should stay home and do social distancing as much as possible. At that day, too, Minister Hajdu said that if you have a capacity to work from home, do so. If you are thinking of going to a restaurant, think again and stay home. Also asking Canadians to conduct only essential business. Today, why are you not asking Canadians to do the same thing, and why are you not giving them that same advice?
Well, I think some of the same advice is provided, for example, in Quebec, in areas where they have been experiencing cases. So I think the difference is that at that time, there was a lot of unknowns about the virus. We knew practically very little at the time, but now we know a bit more. And the concept with the public health officers is that we don't want to apply just broad-based blanket approach to everywhere in Canada, but use the data that we have to try and home in on those hotspots and advise people who lived in those areas now to restrict their contacts. You've seen what's happening in the I think, the red zones of Quebec, where those kind of recommendations are being provided right now. But we also know of some of the negative consequences of broad-based restrictions and stay-at-home orders. So I think local medical officers are trying to still keep, as much as possible, those really important social spaces like schools open as much as they can, while closing, as you've seen, some of the nightclubs or bars and that type of thing. So, I'm really happy that they're trying to do that to immediately reduce that acceleration of cases that we are seeing. So absolutely, some of those fundamentals do apply, but now I think public health is trying to do it in a more focused fashion.
Last week when you gave a press conference, it was about the modeling, and you said that we'd have around 155,000 cases by October 2nd on the worst end of the spectrum, as well as about 2,000 deaths too for October 2nd, which we're approaching. So clearly we have passed those projections, and we will pass those projections as well. So what can Canadians do now, or is it, at what point are we going to see these numbers go down again? I mean, we're seeing the RT level at about 1.4. So numbers are just going up exponentially at this point. What do you want to tell Canadians now in order to get those numbers down in the future?
Well, it's really important because right now is we can do something about it to resuppress that trajectory. So bend that curve down is similar to what we had advised in the past, but certainly in the areas where the virus is really accelerating. So again, keep those contact numbers low, because I think what has happened during the summer and as social and economic spaces open, people are having more contacts. So absolutely, that's really, really important in the areas where the virus is spreading fast. That's the only way that I think we can reduce that acceleration as quickly as possible. All of those other public health advices continue. So I think you need to ask yourself, do I really need to do this particular activity? There's essential things that you must do, going to the grocery store and while keeping yourself safe. But I think this is the time where you should just cut down on anything that's generally non-essential if you're in those areas where there's a lot of viral circulation. And so I think that's really key. And, the whole hygienic measures, physical distancing, wear a mask. I think at the beginning of the initial epidemic, Canada wasn't a country where mask wearing was quite prevalent. Whereas now, even through surveys, I know it's uncomfortable, people don't like it, but a lot more Canadians, at least 75%, are actually very supportive of mask wearing. So that's another layer of protection to try and reduce transmission. No layers of protections 100%. It's just adding more will dampen that transmission, that RT value as fast as we can. So absolutely crucial moment right now, particularly in Ontario and Quebec.
Dr. Maybe I'll just add a couple of points. I think it's important for all Canadians to understand that we are in control of our own destiny. So the statistics and data we're giving you today, in many ways, are a reflection of the activities of what Canadians were doing about 2 weeks ago. And so even a week from now, if we give you further data and there's an increase in case numbers, is probably a reflection of what happened a week ago. We can't change that, but we can change what we do today. And we'll see hopefully the fruits of our I say, changed behaviors 2 weeks from now. So I think, like I say, it's a bit of a catch-up game. We look at the data today, but it's really a reflection of what happened maybe 2 weeks ago. And so what we do today will make a difference. So let's see where we are 2 weeks from now.
From the Canadian Press. I'm just curious, we've seen several weeks now where particularly in Ontario and Quebec, testing backlogs have been growing. People are waiting in line, some are giving up. How concerned are you today, Dr. Tam, that this testing backlog is contributing to the rise in cases and the difficulty in contact tracing?
So, there may be a variety of reasons, and I don't know how many spots there are lineups. It may not be uniform across different areas of Ontario and Quebec, but we've seen those lineups. And I think partly public health authorities there have now been asking people who, if you this is a nice to know kind of test, don't line up right now. Please line up for people who have symptoms or who have the potential for having been exposed, or you're being told by public health, which is very important. So let's just reflect quickly on Ontario. I think they've been doing a lot of testing, really accelerated, and their percent positive is still relatively low. So it's 1 point something, I don't know what it is today, which means they're testing a lot of people to find those positives. So refocusing to the targeted areas like the Torontos and the Ottawas and Peel, I think those areas is really important. You can't distribute your testing too broadly, but really home in on supporting those areas where you're seeing those accelerations. So some of it is simply access. Having those extra access points like pharmacies might help, particularly in those cities or those areas. Two is that absolutely it is worrisome, because if you have a significant backlog and people don't get the test results for a number of days, you've now lost time for doing the contact tracing. And so we can shore up the contact tracers, but if you don't know that someone's got a positive test, you're not going to be beginning the contact tracing, and that can help accelerate the spread. So it is something that we really must all work together to try and reduce as quickly as possible.
We also heard earlier today in a briefing that they've now sort of told the makers of these antigen tests, other tests, what accuracy they expect, sort of what the standards are. I heard you say earlier that you're starting to work with provinces and other public health chiefs about these tests and sort of what they might be able to be used for. Why are we only doing that now? Why didn't we do that 6 months ago?
Well, a lot of these didn't exist, and so the manufacturers of some of these rapid tests and antigen tests have been working really hard, and I'm really happy that some of them have now applied to the regulator in Canada. I mean, people have been doing outreach to different manufacturers. Someone has to submit these tests and make it available in Canada. So what we're doing in terms of public health guidance is we are now developing the guidance so that when the first antigen tests come on board and we can get access to it, we'll be ready with those recommendations. But, it's a complex landscape. There's global supply challenges as well. So I think what we want to do is see as many of these tests being submitted to the regulator so that we can have a bigger portfolio to draw from.
We are going back to the phones. Opérateur, prochaine question.
Operator, next question.
Merci, thank you. La prochaine question, Micheline Laflamme de Radio-Canada. Please go ahead. Your line is now open. Votre ligne est ouverte.
Your line is open.
Merci. Dites-moi, comment expliquez-vous le taux de contamination qui est plus élevé au Québec qu'ailleurs? Est-ce que les écoles ont quelque chose à voir avec ça? Quelle est votre analyse de la situation?
Merci pour la question. C'est difficile pour moi pour commenter cette situation au Québec parce que c'est vraiment les autorités de santé publique au Québec qui sont plus au courant, qui ont vraiment les données probantes, qu'est-ce qui se passe, qui savent actuellement c'est quoi les situations épidémiologiques au Québec. Au début, l'hypothèse est que peut-être le virus a été introduit au Québec peut-être un peu plus tôt que le reste du Canada à cause de la relâche scolaire a eu lieu plus tôt au Québec au mois de mars avant le reste du Canada. Et les Québécois qui peut-être sont sortis du pays ont été contaminés peut-être en Europe, dans les autres pays, et puis sont retournés au Québec. Mais après, avec tous les efforts des Québécois et aussi les Canadiens à travers le pays, on a aplati la courbe pas mal au printemps aussi en été. Mais avec la situation aujourd'hui, je pense que le défi, c'est que tout le monde, je pense, est tanné de toutes les mesures de santé publique, confinement, tout ça. Et les autorités, je pense que c'est vraiment un défi aussi. Comment on peut, ouvrir l'économie, aussi les secteurs, aussi la société au fur et à mesure, mais aussi garder, comme on dit, un niveau d'activité de COVID-19 gérable. Ça, c'est vraiment le défi. Et on voit maintenant actuellement que avec les données que, oui, il y a eu des éclosions un peu partout, peut-être au Québec, surtout dans les zones rouges. Et ça, c'est le défi parce que au Québec, on a maintenant réimplanté des mesures plus, comme il dit, sévères pour les zones rouges. Comme explication pourquoi peut-être les taux sont plus hauts au Québec, je ne sais pas, mais c'est intéressant que les autorités de santé publique, même le premier Legault et aussi Dr. Arruda, j'ai entendu hier que c'est vraiment des mesures dures. Et on sait que les Québécois, on aime faire le party. Hein? C'est quelque chose peut-être qui fait partie de la culture au Québec. Et maintenant, ce n'est pas le temps de socialiser. Même un défi peut peut-être arrêter les rassemblements, même de famille, pour 28 jours. Donc, c'est peut-être une possibilité, une explication pour ce qui se passe actuellement au Québec. Merci.
Et en ce qui concerne l'application COVID-19, là, elle est déjà en fonction dans plusieurs provinces, ou du moins dans quelques provinces. Est-ce qu'elle a déjà montré son utilité? Pouvez-vous nous dire, alors que le Québec envisage peut-être de l'utiliser, de quelle façon ça a changé la donne dans ces provinces?
Je pense que c'est sûr, l'application à la COVID, d'après moi, c'est toujours mieux si c'est disponible à travers le pays, que toutes les provinces et territoires utilisent l'application à tous les résidents, les citoyens de chaque province et territoire ont accès, on peut télécharger l'application. Je sais que peut-être il y a quelques semaines que le gouvernement du Québec, à ce moment, a dit que ce n'est pas le temps pour le Québec. Ils ont fait leur propre analyse, mais la porte est toujours ouverte. On continue d'avoir des bonnes conversations, une bonne collaboration étroite avec les autorités du Québec. Et je sais qu'ils sont en train encore de faire, une autre analyse et avec la situation qui se présente actuellement au Québec, je pense que on continue d'avoir les conversations et moi, personnellement, j'espère peut-être que l'application sera disponible partout au pays, incluant le Québec.
Prochaine question en ligne.
Merci, thank you. La prochaine question est de Anne-Caroline Desplanques du Journal de Montréal. Votre ligne est ouverte. Your line is now open.
Oui, bonjour. Ma question porte sur les tests rapides qui ont été annoncés d'avoir été réservés un petit peu plus tôt pendant la conférence de presse. J'aimerais avoir un petit peu plus de détails sur ces tests. Donc, ce serait le test Rapigène. Quel serait le temps pour l'approbation de ces tests-là et donc leur distribution?
Moi, je vais commencer. Les tests rapides qu'on a annoncés aujourd'hui, ils sont encore en train les autorités de réglementation à Santé Canada, nos collègues, ils sont en train encore de faire leur analyse, leur évaluation, mais on espère que l'approbation peut-être aura lieu peut-être bientôt, mais je ne peux pas dire, vous donner une date précise. Le but de ces tests rapides, on a déjà constaté, c'est aussi comme la plateforme, c'est basé sur le PCR, c'est comme une autre dépistage moléculaire. Et l'utilité de ce dépistage est vraiment au point de service, donc je pense dans les communautés plus isolées. Je pense que dans le Nord, pour peut-être les communautés aussi avec les Autochtones, c'est vraiment un défi maintenant actuellement parce que si quelqu'un, peut-être on pense que quelqu'un est contaminé avec la COVID-19, il faut prendre l'échantillon, il faut avoir le transport au laboratoire au sud. Avec un test rapide, plus comme des points de service, c'est possible d'avoir un résultat plus rapide, même dans 15 minutes. Donc, ça, c'est le but en général, mais c'est sûr, on va avoir des autres applications, utilisations pour cette technologie quand c'est approuvé.
That technology once it's been approved.
En question suivie, c'est bien le test Rapigène de la compagnie sud-coréenne Rapigène. Et puis, ma question de suivi, c'est sur le niveau de sensibilité. C'est un test, celui de cette compagnie, qui est déjà critiqué en Asie pour son faible niveau de sensibilité. Qu'est-ce que vous pouvez nous dire là-dessus?
OK, j'ai mal compris la question. Je pense que vous avez parlé de le test Abbott aussi comme des tests plus rapides, point de service. L'autre dépistage que vous avez mentionné, moi, je ne suis pas au courant exactement c'est quel le nom de compagnie.
Mais si j'ai bien compris, l'annonce plutôt tout à l'heure, c'était de Rapigène. Est-ce que c'est bien ça?
Is that correct?
Oui, c'est ça. Oui, en anglais, Abbott ID. Oui, c'est ça. C'est des laboratoires Abbott. C'est une technologie de dépistage moléculaire pour avoir des résultats en point de service. Et la question, c'est?
C'est sur son niveau de sensibilité à ce test-là. Est-ce qu'il a...
OK. Ce qu'on comprend maintenant, peut-être je peux laisser aussi aux autorités plus les experts, mais ce que je comprends, la fiabilité, la sensibilité des tests rapides de Abbott, c'est pas mal pareil, plus semblable à comme dit le PCR, le test au laboratoire, comme dit c'est la norme d'excellence. Donc c'est pas mal pareil.
Merci beaucoup. Ceci met fin à notre conférence de presse. Thank you, everyone.
Thanks. Hi, Tom Perry with CBC. Can I ask you about out in BC, they're using the swish and spit test. Is that something that we're going to see coming across the rest of the country? And why is it that we're seeing it in one part of the country right now and not in others?
Yes, and I think you will see more of that. It's been worked on in different parts of the country with